Well, today on the show, we're talking to Dr. Sonya Spencer at Spencer Chiropractic over here in Gulfport. Dr. Spencer, how are you?
I'm doing fantastic.
And today's segment is just so fascinating to me. We're talking about brain waves. We're not talking about chiropractic, we're talking about brain waves. Well, kind of, yes, we are. But the thing is this, BrainCore neurofeedback is something brand new that you're working with. And we've been sitting here talking about this for about 15 minutes before we started shooting. It's like, I have to get this done. Tell us a little bit about this, if you would.
Okay, this is something brand new that I've just added to my practice, but I've been interested in for a long time. This is something that looks at abnormal brain waves and some of the symptoms that they would cause in patients. Some of the symptoms are actually listed on this poster right here. If you have abnormal brain waves, it can cause any of these neurological symptoms that are listed here, like ADD, migraine, tension headaches, memory loss, learning disorders, insomnia, anxiety, fibromyalgia, and chronic pain. What a person would have to do to find out, because not everybody is a candidate for neurofeedback, what a person would actually have to do to find out if they're a candidate for neurofeedback is to have what's called a QEEG, where we do what's called a brain map on them to test their brain waves to see if they have any abnormalities going on in there that may be contributing to these conditions. And if that in fact is the case, they may be a match for neurofeedback. That's part of the testing that we do here in our office. Everything starts with a brain map and to see if they're really a candidate and if we feel like we can help them get their brain waves regulated. And so that's part of what we do here in our office now, and we're really excited to have this therapy in our office that normalizes brain waves. I want you to take a look over there at that poster, Jim.
Wow. Neurofeedback should play a major therapeutic role in many difficult areas. In my opinion, if any medication had demonstrated such a wide spectrum of efficacy, it would be universally accepted and widely used. And that's from Dr. Frank H. Duffy, professor and pediatric neurologist from Harvard Medical School.
That's right, and so this is a very safe and effective form of therapy that does not use drugs, no surgery, there's no dangerous side effects, and that is what's so fantastic and phenomenal about it. Even though it's not covered by insurance companies, it's natural, and there's nothing invasive about it, and there's nothing harmful to your body about it. It just fixes problems that are present, and I want to go over with you some of the things that can cause abnormal brain waves, because I'm sure everybody's thinking, well, how did my brain waves get out of sync to start with? You know, what could cause that to happen to me? I've just been rocking along fine all my life. How could some of this stuff just happen to me? And how does a person develop some of these conditions, and how come nobody's been able to fix me, and the only alternative I have right now is medicine.
Medications.
Yeah, and long-term medication for the rest of my life to treat this condition that I have.
All right, so we're going to sit down and talk more about this very interesting new thing called BrainCore neurofeedback. Dr. Spencer, tell us what some of the causes of brainwave dysregulation are.
Well, brainwave dysregulation can be caused by any perceived threat, like in the case of a person going through something that would cause PTSD, drugs, toxins, vaccinations, poor nutritional status, lack of sunlight, not getting enough vitamin D.
Right.
Of course, any emotional or physical trauma, emotional or repeated physical stress, lack of exercise, or just having spinal subluxation, having chronic pain, you know, for long periods of time. This can cause brainwave dysregulation, and let me explain to you how it can do that. Anytime you have something going on in your body for long periods of time, it can actually change how your brain perceives your life around you. So that can get input into your brain, and your brain can develop certain habits surrounding that.
Right.
So that can cause the brainwave dysregulation. So how we test for that is, again, doing that QEEG. Some of the things that we see in brainwave dysregulation, for example, if you have delta theta, which is a type of brainwave dysregulation, it can cause a variety of symptoms. For example, you can see ADHD on here, and dementia,
Right, yeah.
excessive speech.
Autism.
I'm sure you've met somebody who just never shuts up. So,
Me.
but anyway, this would show up on your QEEG.
Right.
And a person who has alpha dysregulation, and alpha is a type of brain wave, they would have different types of symptoms.
Right.
For example, they may be in more of a depressed mode or have symptoms of fibromyalgia or anger. And a person who has beta dysregulation, they would have symptoms like restlessness, anxiety, migraines, or OCD. So we would have to look at your total brain picture to see exactly what's going on with you.
Wow.
One of the things I want to point out to you is the American Academy of Pediatrics has listed in attention and hyperactivity behaviors for evidence-based and child and adolescent psychosocial interventions, biofeedback as a level 1 best support for treating these problems.
Wow.
So this, again, pointing out that this is a fantastic way to help children without drugs.
Yeah.
And so many
Because
parents...
everybody thinks that that's an easy fix. Okay, your child has ADHD, we'll put them on medication.
And so many times parents are looking for a different alternative and not really knowing where to turn. So again, we don't actually treat these diseases. We're looking for ways to see if the brain pattern is abnormal,
Right.
and ways to normalize the brain patterns, making the child the healthiest child possible without drugs or surgery.
Well, we have just about a minute left. So if someone's interested, what do they need to do?
Well, they can go to braincoretherapy.com and look at their research. And I am attached to that website. They can call my office directly. Go to my particular website, spencerchiropractic.com. Call my office, 575-8660.
Yeah, the number's on your screen, as is the website.
Yes, and come in and have your BrainCore map done and see if you're a candidate for this type of care, or if your child's a candidate, and see if this care could help you.
Could someone that maybe had a stroke, could they be affected by?
Anyone could potentially be
They're calling already.
They're calling already.
That's
be
wonderful.
a candidate.
Okay, well, thank you so much. This is BrainCore neurofeedback. This is an amazing thing. If you want some more information, as Dr. Spencer said, give them a call. The number's on your screen. Be sure you go to braincoretherapy.com, the website, and to find out more information about it and see if your child is a great candidate for BrainCore therapy.